Hey guys, Lori here, pharmacist. So, haven't been on here in a while. Went to Oklahoma, getting my pharmacy license there, so you have to appear before the board. Got to see an old friend, visit Oral Roberts University, where I did my first year of college when I was clueless and had no idea what I wanted to do. But anyway, it was a great trip. Good to be back. So, I had a grandmother write to me and ask about albuterol or Ventolin inhaler, Pro Air inhaler in a child that's 4 years old. And I had been wanting to make an albuterol video based on my own experience and what I think that you all need to know about this drug. So here we go. Albuterol is a very commonly prescribed. It comes as an inhaler. It also comes as a nebulizer solution. It is what's called a short-acting bronchodilator. It works quickly to open up your airway if you're having an asthma attack or breathing issues related to constricted bronchioles. It doesn't last a really long time, about 4 to 6 hours. But anyway, it does work quickly. It's what we call now in the medical field a rescue inhaler. Or yeah, it's a rescue. So, but albuterol does not come with its issues. And I say this from personal experience. When I was in my 20s, I was first prescribed an albuterol inhaler, my early 20s. I developed asthma as a child. I don't remember how old I was. I want to say 4 or 6 years old, somewhere in there. After what I've learned about vaccines, I'll be honest, I believe it was vaccine induced because I was definitely not born with asthma. And back then we didn't have the albuterol. I was born in 1962, so we didn't have the albuterol and all the inhalers we have going on now. So I just had to weather it out. And, they told me I was allergic to pollen, and I knew I was allergic to cats and shedding dogs and stuff like that. So that's what I thought were the culprits, never realizing that something actually triggered that since I wasn't born with it. But anyway, in my 20s, I was prescribed the albuterol, and I honestly thought it was a lifesaver. I mean, it was. It was like suddenly all I had to do was inhale this thing, and it would open me up, and I wasn't pulled down for a couple of days with an asthma attack as I had been in the past, and then had to go on like a prednisone dose pack or something to reverse the symptoms, which I never got as a child. I only got as an adult. What happened to me with albuterol is that continued use over 20 years plus, I started realizing that my asthma, my breathing issues, my allergies were getting worse and worse. I was in my 40s at this point, and I thought, this isn't good, Lori. You're not getting any better here. You're getting worse. I developed a chronic cough. It was just like my airway was hypersensitive to like the slightest little thing, and I would have to use my albuterol inhaler. I've never had a nebulizer, but I was definitely moving in that direction. I was having more and more frequent asthma attacks. And I started doing research on my albuterol inhaler because what occurred to me was that my condition had worsened over the 20-year span. It had not gotten any better. I was reacting to more things rather than less things. And so I started doing some research, and I came across an article about rebound bronchoconstriction with albuterol use. That was me. And what I realized is that I had to come off the albuterol. I had to get rid of it. And the only way I knew to do that was to talk to my doctor, who, thank God, was willing to work with me, about a prednisone prescription. And so I put myself on prednisone. I basically asked him for what I felt like I needed. I mean, he was literally looking at me like, but he trusted me, thank God. And he gave me this prednisone prescription. I put myself on, I want to say it was like 80 milligrams of prednisone a day. I ended up on prednisone for about 2 months, and I did a descending dosage, and I just let my body and my knee, my breathing issues determine what dose. I actually documented it at the time, and I cannot remember. I lost it. I don't know. I don't know where it is. But I remember being on prednisone for about 2 months because what I was trying to do was desensitize my lungs from all the albuterol use and abuse that had gone on. And it worked. Thank God. And I mean, I'm literally praying through this whole thing and just doing what I felt like God was leading me to do. And that's what I felt like he told me to do. And so after 2 months, I started weaning myself completely off the prednisone in hopes that my body would not need, my airway would not need the albuterol to function. And sure enough, it didn't. I was fine. And what has happened as a result of that over 10 years later is that I am completely albuterol free. I'm completely asthma free. I mean, I don't even have allergies anymore. It's incredible. Like, pollen can come and go, no issues. I have my cats. Now, granted, my cats aren't sleeping with me. They're mostly indoor, outdoor, as far as they have a back porch. I haven't really tested it as far as the dander of cats, but I can just tell you, I don't have the seasonal allergies that I used to have. And that was another thing. Albuterol really, and if you read about the side effects, it causes rhinitis. There's something with albuterol, at least for me, that it caused a lot of mucus production. I just don't have that anymore at all. I don't have the coughing. I mean, literally, it's like I've been healed. And I do believe I've been healed. But I believe that I've been healed because I stopped what had exacerbated my problems. I also am off dairy. I realized after years of being off albuterol, I kind of factored dairy back in the form of yogurt, and I started having breathing issues again, and I realized you put dairy into this equation. So for me, dairy's a no. I'm not saying it's for everybody. I don't know. You just got to figure out what your body does and doesn't respond to, which I think is so important in our health anyway. We are not all the same. We react to different things, so you've got to kind of figure it out for yourself, what works for you. I do believe that a plant-based diet is absolutely the best way you can go for any man, woman, or child with minimal to no dairy, minimal to no animal products. But you figure it out for yourself. But the bottom line is albuterol is not your answer. And as I am in medication therapy management, talking to people all over the U.S., I know even more how bad albuterol is because I come in contact with people all the time. And one of my first questions when I see they're on an albuterol inhaler is, how often are you using it? The guidelines, interestingly enough, the prescribing guidelines for albuterol have changed drastically over the years because I believe that the pharmaceutical industry, the powers that be, realize that this drug has this potential. And it's now been reduced to, they want people to only be using albuterol about twice a month. And if they're not, they want them on we recommend what's called controller inhalers, which is a little scary too, an inhaled corticosteroid, sometimes with a long-acting bronchodilator, which I cannot honestly say that I know the long-term effects of, because the long-acting bronchodilator works similarly to albuterol, it just, the effects last longer. So is it increasing your airway sensitivity? I'm thinking probably. But anyway, back to the inhaled corticosteroid. it's not as caustic as a oral steroid because it's not absorbed so much into the bloodstream like with an oral steroid. But it is more first line what we're recommending to people and what I want to see people get on, especially if they're not willing to change their diet and work on reversing their disease and they're just looking to use an inhaler to get the job done. They need to be on an inhaled steroid because it's just hopefully not going to, it doesn't have the rebound effect that albuterol has. Albuterol can cause rapid heartbeat. It can cause anxiety. I urge you, if you want more information about albuterol, to just put into your search bar albuterol side effects. There's a laundry list. There's a laundry list of side effects, as is with all drugs. So be aware of that. Using it in children, I think this woman said that this daughter's using it twice a day, and her granddaughter. Scary, very scary. We actually have a phone call scheduled, so I hope to find out more information. But albuterol, while it works, you pay to play in the long run, or at least that's what I'm seeing with the majority of the people I'm counseling. And I try to explain to them about the airway reactivity and how it can actually make your disease worse over time, and to move to a inhaled steroid to help to control their breathing. Anyway, I'm just going to go over again the names of this inhaler. The drug name is albuterol, and it does come in a nebulizer and an inhaler. The marketed names in the U.S. are ProAir or Ventolin, or they now have the generic albuterol. HFA is what it's called. So be careful. If you have any more questions, feel free to contact me. It's LoriLove77@gmail.com, or you can PM me. Anyway, that's the news from here. Love you guys. Talk soon.